Okay, hello everyone. We're going to be talking about CAM therapies in pain and palliative medicine today. Um, this is a long presentation. We'll start with the definition of CAM therapies. There's an old definition and there is an updated one. With the old definition, uh, we have complementary and we have alternative. Complementary means non-conventional or non-mainstream practices, but such as turmeric, for example, as an anti-inflammatory, with NSAIDs for pain. So it complements actually the conventional treatment, while alternative means it replaces the conventional treatment, such as St. John's wort, for example, in treating depression, it replaces the SSRI. CAM therapies plus conventional medicine equals integrative or holistic medicine. Now, with the updated definition, the difference is alternative medicine is defined as the use of non conventional modality that has no scientific evidence of efficacy in place of conventional medicine. So they added this little thing here that this doesn't have a scientific evidence. Okay? And thus, they changed the terminology to CHEM instead of CAM. Only they want you to use the complementary and integrative medicine. This definition comes out of this huge institution called the National Institute of Health from Washington, D.C., United States. They have a section for complementary medicine. According to the old definition, CAM therapies can be classified into 5 categories: mind-body medicine, biologically based, manipulative, and body-based, energy medicine, and whole medicine therapies. The commonest, thing that we use, in fact, is the natural products, around 17.7% in the United States, followed by deep breathing, 10.9, and then you have the manipulative and body techniques like yoga, tai chi, qigong, and all that, around 10%. Before you pick up any non-conventional procedure or technique, you have to think about this echo model. Number one, with the echo model, is there an evidence behind it or not? Number two, the cost, because it could be very expensive, and thus the patient will not be able to pay for it. Then you have to use another way to do that. Harm, is it going to harm the patient? The risk benefit ratio is very important. And lastly, the opinion of the patient about this specific treatment that you'll be giving to them. Biologically based therapies are recommended for cancer patients. Nowadays, we have like a nutritionist almost in every cancer center to help with the nutrition of these patients, and there is evidence 1B for this. Some of the top selling herbs and supplements, fish oil, for example, is used for depression. We use it for fatigue. We use it for osteoarthritis. Use it for hyperlipidemia, and so forth. So it's a very useful, CAM therapy here. Number two, carnitine is used for patients with carnitine deficiency, especially like patients on dialysis. They get a lot of cramps, and they give them L-carnitine to help with that. Valerian is another herb for sleep. Very, useful and very commonly used in Germany. American ginseng is used for fatigue. And then we have a Korean ginseng. They use it for diabetes. Coenzyme Q10 for myopathies related to statins. Melatonin for circadian rhythm disorders. Ginkgo for dementia as a cerebral stimulant. Alpha lipoic acid, for neuropathy, especially diabetic neuropathy. St. John's wort for, depression. Feverfew, migraine. By the way, feverfew is very commonly used in UK, okay, for migraine prevention. A butterbur is another agent for migraine. A glucosamine chondroitin, there is so much research on this agent. And I used it myself on so many patients. I can tell you, it does really help, especially in mild to moderate osteoarthritis, but not in the advanced cases. Unfortunately, some physicians, they prescribe it in advanced cases. Then we have vitamin C, which helps with immunity and helps also to prevent complex regional pain syndromes in upper extremity fractures. Riboflavin for migraine prevention. Vitamin D3, for osteomalacia. B12, this is an epidemic too, because we have an abuse of PPIs in our world right now. And I had two cases of a B12 deficiency and subacute combined degeneration. It was, catastrophic from PPIs. You gotta be careful about that. I always, check B12 and vitamin D to all my pain patients. Zinc is used for, diaper dermatitis, and it could be used for dysgeusia. Magnesium for muscle relaxation and also for constipation. It has also a mild NMDA antagonist activity. Okay, we'll jump into aromatherapy, which is basically essences from oils extracted from plants and flowers, such as lavender, peppermint, sandalwood, chamomile, and lemon. Neurotherapy is a technique developed by Heineke brothers, from Germany in the 50s of last century, where they inject, very diluted local anesthetics under the skin. This is not for palliative patients, guys. This is only for pain patients because it depends on your, neurovegetative system to respond, and this is not available in patients that are pretty sick, like palliative patients, for example. Okay, prolozone is another, camp therapy technique. Basically, ozone is an immune modulator used for osteoarthritis, used for trigger point injections, used for intradiscal injections, and also for, neuroforamen injections for radiculopathies. Hyperbaric oxygen therapy is used to heal damaged tissues caused by radiation therapy and enhance the effectiveness of chemotherapy and radiotherapy. Manipulative and body-based practices. This is the second part of the camp therapy here. It's massage therapy has been shown to reduce stress, improve circulation, relieves musculoskeletal pain, enhances sleep, lessens depression and anxiety, and improves range of motion. These are types of massage. By the way, cupping is a type of massage. Okay, aromatherapy massage. There's reflexology. Okay, it's also a type of massage. Chiropractic and osteopathy. Chiropractic is basically a relationship between body and structure, body structure and function. And it's been shown that it helps in treatment of acute lumbar radiculopathy. Okay, these manipulations or adjustment, it's all of it, based on manipulating the spine here. But there are only low quality evidence for chronic conditions or cervical or thoracic radiculopathies. Osteopathic medicine is a very nearby practice, and it has integrated with the conventional techniques in the United States, and these guys graduate as DO instead of MD, Doctor of Osteopathy, and they actually join most of the residencies in the United States, such as medicine or surgery, whatever. Chiropractic, you know, developed by Palmer, and osteopathy, which is a more gentle technique developed by Still. And both of these techniques actually showed up, in the 19th century, almost at the same time in the United States. Okay, Tuina therapy is an old Chinese way, to do massage here. Okay, and then cupping. All of you guys know cupping. Hagama. Mike Phillips here, a famous swimmer, doing cupping for his shoulder. This guy had Marfan syndrome, and that's why all his joints were pretty lax. Nowadays, we have electric cupping, guys. I just bought a couple of these. You can buy them, from the net, and you can do them to yourself. Very nice. Okay, acupressure is another way to do massage, and we have different gadgets for that. By the way, reflexology is being shown to be done by the Egyptians, and this picture is from Saqqara Pyramid, where the doctor is massaging the feet and the hand of the patient here, and it's written. Patient is saying, don't hurt me, and the practitioner is saying, I shall act so you can praise me. So this is an old Egyptian, therapy. This is for the hands. This one is for the legs or the feet. Then we're gonna talk about mind body medicine here. So these include techniques such as biofeedback, relaxation training, support groups, hypnosis, and so forth. Uh, Starting with the support groups, this is a very important technique, uh, you know, um, and it does help to obtain information. It helps with expressing and sharing feelings, improve communication with professional staff, discusses problems of communicating with others, and exchange practical advice. I've been, myself in this support groups, and I can tell you, it does help the patients quite a bit. Just feeling that you're not alone. And there are patients that are suffering more than you, helps them a lot. Prayer therapy is a very important, method for treatment. And, is as an adjunct to the other, treatments the patients are receiving. Biofeedback techniques, cognitive behavior therapy, and there's some, kind of more, recent technique that we use right now called the ACT, or the acceptance and commitment therapy. Hypnosis is an very old technique discovered by Frank Mesmer, and it's used for pain, nausea, fatigue, hot flashes, sleep disorders, and help with coping. There's a lot of mythology about what actually hypnosis means. Hypnosis is an awake state. It's a state of relaxation, imagination. It's an exercise for your mind. And the bottom line, you establish a rapport with your unconscious. Music therapy, like here in this picture, music therapy, for example, or Sufi music from Turkey here, And there's been at least 17 studies that showed music as an adjuvant to approach pain to hospitalized patients. Also, it helps with coping, anxiety, grief, pain, and emotional development. Guided imaging is a mind-body intervention where the patient, generate mental images that stimulates or recreate the sensory perception of sight, sound, taste, and smell. This lady, her name is Helen Bonny. She added music to guided imagery, and she called it, guided imagery and music. Art therapy, the most famous is Molly Hagair, and she has published a lot, doing teaching art therapy for chronic pain patients. This is just one of her, uh, basically things that she was presenting here. Uh, Another kind of relatively innovative technique is called therapeutic photography. So we don't have a lot of information about it because, the literature, this is just an evolving field developed by this young lady, Jane Caesar. So I want you to think about it. Maybe this could be a part of, a study in your institution. Um, and basically using photography to help with coping and reestablishing old memories and stuff like that. Mindful meditation, this is very famous in the United States, and there in your phone, I'm sure you'll find a lot of applications about mindful meditation here. And this was developed by John Kabat-Zinn, and he actually got these ideas from the yoga, and he basically separated it from the religious aspect of yoga. Okay, mindfulness, awareness, present moment, focusing on the present moment, and acceptance. Progressive muscle relaxation by Edwin Jacobson. This is one of the techniques that I use with my patient, to help them with coping and insomnia, or headaches, and musculoskeletal pain. Very simple technique. You ask the patient to start relaxing the body from bottom to above, starting from their feet up to their head. Therapeutic journaling. I love this one. You know, this is developed by James Penn Baker. And basically, you have a journal that you write on, you know, only for 15, 20 minutes, for 4 consecutive days. And basically, you don't have to be, poetic or anything. You just write whatever comes in your mind. All these, bad, things that happen to you, just write them up, And usually, by the end of the fourth day, you'll feel much better. It doesn't work on everyone, of course, And if it doesn't work for you, you might as well, talk to your psychiatrist. Okay, dignity therapy. This technique is gaining a lot of momentum in Europe and United States, developed by Harvey Shukinov, and basically, interviewing the patient and trying to elicit some of the good memories and the good things that the patient have done throughout their life, and then review it with them later on. Maybe you can add some pictures, you add some certificates and stuff like that. Diaphragmatic breathing. This is a very super simple technique you can teach to your patients. The whole idea is that you breathing through your diaphragm. You have your belly has to move. Otherwise, you didn't get enough, inspiration. Yoga is a posture-based physical fitness. Stress helps with stress relief and relaxation. Okay, I call yoga as a. By the way, yoga is a prayer, a kind of prayer. But the Americans and the Europeans, they kind of extracted the non religious aspect of it, and they're using it as a stretching exercise, and they're using it as a meditation, and they're not using it in the context of a religious context. Just to kind of clarify with you here, because if you're using it in religious context, then it might contradict with some of the religions like Islam and Christianity and Judaism. And you will have a lot of debate about it in the internet if you want to look it up. Okay, one of the techniques that I like to use is chair yoga. And you don't have to tell them yoga; just tell them this is a stretching exercise. I mean, I don't think there's anything wrong with that. But this one, is very useful in palliative patients. Virtual reality. This originally was developed by Jaron Lanier, and actually you can use it for, especially in adolescents and kids, and they see all kind of nice scenes and music and all that, and it does help quite a bit with pain. This is also another area where you can do research in your institution. Uh, and by the way, the machine, I mean, the most expensive one is like $300, and there are much cheaper, machines in the market. Pet therapy, this is another thing that we use for, cancer patients, and also for chronic pain patients. Storytelling for kids helps with their well-being, dignity, quality of life, and it reduces depression, helps with preserving self-identity and connecting with others. Okay, we'll jump into the third part of camp therapies, which is basically the energy therapies here. And we have, um, you know, uh, we know that it actually helps with anxiety, 1B, and it helps with pain and fatigue, grade 1C, uh, you know, as well. So that's very good. One of the techniques is Reiki. This is developed by a monk from Japan. His name is Mikao Yusi. So this is another type of prayer, similar to yoga, but from Japan. Okay, and basically the idea is that you're, collecting the universal energy and use it to connect with your patients here. Qi in Japanese is like Qi in Chinese, means energy. Qi equals Qi, right? And this is the way they do it. They collect the energy, and So again, there's some debate about it as far as whether this is a prayer or just a meditative technique and so forth. Qigong is Qi is the Chinese word for energy. Is for energy cultivation. Qigong means energy cultivation. Okay, I kind of say that Qigong is basically a very simple exercise, simple breathing exercise. And there are literature that it does help with pain and also in cancer patients. Acupuncture, okay, developed, by this guy that wrote the Yellow Emperor Classic of Internal Medicine. It's been shown to be useful in nausea, vomiting, xerostomia, dyspnea, and neuropathy. Uh, And it's basically based on the yin and yang, balancing the yin and yang, and basically also depends on moving the chi or the energy freely in around your body in what we call the meridians. Nowadays, we know that actually acupuncture has a neuromodulation, effect, and we were able to pick up this by what we call functional MRI. Also, acupuncture correlates with trigger points, that was discovered by Janet Travell, like 71% correlation between acupuncture and trigger points. So acupuncture, in fact, actually releases the muscle spasm, even without putting any material inside the joint. Acupuncture versus TENS unit. Acupuncture is based on releasing of chemicals, endorphins, okay? But TENS unit is based on the gate theory, okay? This is I just bought one for my son today. This is a TENS unit, and this is an electrical acupuncture. The guy that developed the, the TENS unit or the gate theory is Melza Kanwar. And these guys, they won the Nobel Prize in 1965. The one that discovered the mechanism of action of acupuncture is Bruce Prominas from Canada. And he was actually, this guy was the student of these guys. That's the gate theory. This is a fundamental theory in pain. If you don't know it, forget about it. This is a very important theory. And basically, in two words, you stimulate large fibers that blocks the pain fibers, small pain fibers, the C fibers. Okay, this is the mechanism of acupuncture, and you see here the most important one is the supraspinal, release of opioids, endorphins. The most famous points are the ASD points, anxiety, stress, and dyspnea points, which are basically located in front of the manubrium, and pericardial 6, which is important for nausea and vomiting. Also, you can use it for itching, for xerostomia, like patients that receive radiation therapy and have had a neck surgery. Okay, this is me doing acupuncture to my mentor here. Uh, you can have mild complications, you can have significant complications, including infection and peripheral nerve injury, and you can have serious complications. One of them is pneumothorax, and also there is a foramen here in front of the sternum in about 5% of the patients. It's called the foramen sternale, and it corresponds to an acupoint called CV17. If you put a needle there, you can get hemopericarditis. I avoid it myself. I don't use it. I can do it as acupressure, but not acupuncture. Homeopathy developed by Samuel Hahnemann, which is, there's a lot of controversy about it in Europe and USA. Uh, and basically, it depends on using very diluted, substances to help, uh, curing the disease. Something similar to the vaccine. And actually, the idea is the more diluted, the more potent you have. I use this ointment called Tromil, and it's available in USA and over the counter and Germany. And it's a homeopathic ointment and cream. And I can tell you this helps a lot with trauma. For some reasons, it's made of arnica. Okay, TCMs, it's another one of these whole body medicine techniques like homeopathy and includes a lot of disciplines. The Chinese have two routes after finishing, their high school. Either you go to medicine or you go to Oriental medicine. Okay, and the United States has like schools for Oriental medicine. Ayurveda is another Indian based technique. Helps with different you know diseases like anxiety and all that stuff. And it uses the different types of therapies and herbs. Prophetic healing. I like the word healing instead of medicine. Okay, and there are studies go on been recited on patients that have anxiety and depression, and you can look this up in the PubMed. Okay, I'm gonna basically give you some key learning points here. First of all, there's a huge interest of camp therapists, all over the world. And number one therapy that are used are the biologically based therapy, like for example, herbs, vitamins, supplements, and all of that. Unfortunately, these are not under the FDA control. These are huge businesses, but they are not under FDA, restrictions or regulations. So sometimes you actually have to make, your homework before you buy anything that can hurt you. You need to read about it in the internet. You need to find out whether this interacts with some of the drugs that you're using or not, and so forth. In Germany, they have actually very developed techniques for these kind of therapies, and they classify them and they tell you all the kind of the interactions and so forth. Now, other thing is, patients can access CAM outside conventional healthcare. Like, for example, in the United States, you have acupuncture clinics where they provide treatment with acupuncture needles. They provide, herbs and so forth. I don't have any problem with all of these scam therapies, guys. I have a problem with what we call alternative therapies, because sometimes these doctors ask the patients to stop their current, medications, and uh, until they finish up the course of whatever. And this could include like chemotherapy, for example. I've seen it a lot in a lot of countries. It has nothing to do with, trust me, with education or anything. Of course, these patients, after a while, they get worse and they come back here. So be careful about alternative techniques. Complementary is okay as long as there are no drug interactions. But alternative is the one that I get scared about. Number one, because it replaces your treatment, okay? And number two, most probably it doesn't have any scientific evidence for it. Now, I want to explain to you my experience in the United States about camp therapies. So what I did is I developed a group or a team for camp therapies, and this team included, number one, psychologist, a pharmacist, a religious, a preacher, myself, it included also a nutritionist. It included a yoga master. And we used to do this on a regular basis here, and it was extremely successful. The meeting lasted only 1 hour, and it was a group therapy meeting. And if the patient needed a specific, type of session. For example, acupuncture, I will take him to a room after he's done, and I will do the acupuncture for example. Okay, so I want you to think about it in your institution. I want you to think about doing, you know, a group therapy with, adding integrative kind of, techniques. And I remember we used to do this chair yoga, for example, for these patients. Most of them were palliative patients, so they were not able to do anything, extraordinary. So we used to do chair yoga, just very basic exercises. You can, get them from the NHS, okay? And it's very extremely useful to these folks. I've done also acupuncture, and I used to have once a week acupuncture clinic that was super busy here. So I want to say that whatever I described to you today is in fact applicable, and you can do it, and you can focus on one or two areas. You don't have to do everything. Okay, so please, share with your colleagues and try to integrate some of these camp therapies in your practice. You can use, progressive muscle relaxation. You can use, some of them need education, like hypnosis, for example. But the rest of them, you can read about them, and you can practice immediately. Like, as I said, progressive muscle relaxation or breathing exercises, for example, is also a super simple technique that you can teach